Overdose deaths are on a dangerous trend across the country, but the CDC is softening its guidance for doctors who prescribe them. Nicole Smith talked with an addiction researcher at Vanderbilt about why this is happening. She joins us live now to explain.
Hey, good morning, Nikki. And this comes at a time when overdose deaths are reaching record levels across the country. So I want to start with giving you guys a look at the latest numbers. They're from the National Institutes of Health, and they found overdose deaths involving any opioid was at 21,000 in 2010. That number rose to 47,000 in 2017. And in 2020, there were 68,000 overdose deaths in this country involving opioids. The nation's top public health agency, the CDC, now proposes changing and in some instances softening the guidelines for U.S. doctors prescribing oxycodone and other opioid painkillers. CDC officials said their guidance that was issued 6 years ago helped to slow the kind of prescribing that ignited the worst overdose epidemic in U.S. history. However, it also caused some doctors to become too strict in keeping the drugs from patients who might benefit from them. I talked with Dr. Erin Calipari, who is a researcher in the Vanderbilt Center for Addiction Research. She says in the state of Tennessee, the prescription rate was really high, with 1.5 prescriptions per person. That's what these regulations worked to address.
I think what's happening now is we're looking and saying, okay, we still have an opiate problem. We're still seeing overdose deaths that are incredibly high. During the pandemic, they've only continued to rise. And I think that they're saying, okay, well, people are having a hard time getting pain medication, but it isn't stopping the issue that we have with addiction. So how do we combat those? And I think it's a really, really difficult problem.
And she says part of the solution to that problem needs to be a better understanding and more research into drugs that are not addictive, but that can also treat pain for patients who really need it. I'll have more on that coming up in the next half hour. Reporting live in Nashville, Nicole Smith, News 2.